Go ahead.
Organizations of all stripes, from church groups to Browns backers clubs to Toastmasters, even including departments at work, must have capable leadership, or that group or organization may not be able to obtain the goals it wants to achieve. Leaders cannot reach those goals alone. They must rely on others to carry out specific tasks. Toastmasters International Leadership Excellence Series is a set of programs that addresses various leadership traits and techniques. Russ is today's presenter. He has held a leadership role in each of his years with AG Toastmasters. While he has never held a line management position in his work over the years before his current nursing job, he did hold senior staff positions at the Regional Health Planning Agency and in the Planning and Marketing Research Department at University Hospitals of Cleveland. In those positions, he sometimes had to coordinate and delegate work to other departments as well as to staff in his own area. Here's Russ to tell us about delegating to empower. This is supposed to be a 10 to 15-minute speech. Here's Russ.
Fellow Toastmasters and guests, today I'm going to talk about the really exciting topic of delegation and strong management. What I'm going to do is, as Megan said, for an organization to function smoothly and well, the leaders cannot do all the work. Some of the projects have to be delegated to others. And what I'm going to do is, first of all, tell you about what delegation is, what delegation is not, and then take you through the process. I was thinking of using Toastmasters as an example of delegation, but I thought that was very simplistic and a little maybe tired. So what I'm going to do is talk about two aspects of a project that I was assigned with when I was at University Hospitals. First of all, what is delegation? Delegation is transferring a specific task from one person to another. Leadership involves not working harder or longer for the group to achieve a goal, but getting the group to work as a whole to get the results in a more effective and efficient manner. A more effective and efficient manner. An example here, in Toastmasters, a president or a project leader can delegate jobs to others so the club reaches goals the group has agreed upon. What delegation is not. Responsibility cannot be delegated. Authority to get a task or project done can be delegated, but in the end, responsibility for the overall project falls to the manager. I frequently read that responsibility for something can be delegated. You should delegate responsibility for X and Y. You can't delegate responsibility. If the person you delegated a task to does not perform well, you're the one who's going to get nailed for it. Paraphrasing a couple of lines from Dale Carnegie and also from the Society of Human Resources Management, there is a fine line between delegating and dumping tasks on personnel. Often managers think they are delegating when they assign tasks to employees. Sometimes, though, this is really dumping work on people. Real delegation is assigning accountability for a project's outcomes, along with the authority to do what is needed to produce the results. Let's go over some barriers to delegation. First of all, lack of confidence in something yourself or in others. Second, fear of losing control over a project. Selfishness or vanity. You don't want to share credit. Insecurity. Maybe others do it better, or you're afraid that others do it better. And lastly, self-importance. I can do this job better than anybody else. To give you an example, when I was hired at UH, I was hired part-time to work in the planning and market research. Not marketing research, but market research. And and I came in with the perspective of UH in the area as a regional system, regional healthcare system, several counties, with UH as a major player in that system. My boss, who'd been there for a dozen years, had the perspective of the health system as UH being the center and other hospitals out there someplace, but UH was the provider of services to the area. He would delegate projects to me, and the VP, who our department, vice president, who our department reported to, wanted me brought on full time after a couple of months. So I provided a different perspective of university and how it related to other hospitals. My boss wasn't too enthusiastic about that. We would sit down with other people in other departments, and he would say something like, well, we thought about doing this, or this is the approach that we are taking, or I had this to input into this project. He would not share credit. I think some of the others knew that probably there was other input, because that's typically not how he functioned. Delegation steps: decide what to delegate, who will do the task, assign the task and get acceptance, grant authority, and establish accountability. I'll give you two aspects of the job that I was assigned. The hospital decided, UH decided to start providing home care services. They hired two managers who were nurses, two nurse managers, to oversee the project or to administer the project. But that was all. Where did they start? Where's the market? We have to identify the market. Those are two of the aspects of the project that I was given that job. So two of the aspects, were to identify the market and the service area. Hard data, soft data. We had people in our department who were good with handling demographic data, population projections, and sitting down with the nurse managers who I had many, many meetings with. We mapped out likely where they would want to provide the home care services to. Identifying those zip codes, sex-specific and age group-specific population estimates were given for current, and we needed to project 5 years down the road. We had a couple of staff in our department that could handle that, so they had that job. The big problem was, how many patients would there be? For that, we had to delegate, we had to figure out where the people would come from. Do we get numbers of discharges in certain diagnosis categories over a period of time and find out where that information, where those people came from? That would be relatively easy to do. The problem is home care. Where are those people likely to come from? Maybe from clinics, from outpatient clinics or outpatient services. Information like that wasn't maintained by the university, by UH. Where to go to get the information? Trying to figure out what to delegate and who will do the task. Clinic managers, the different outpatient clinics and outpatient services, they might be the ones that are most capable and who know the job best. So I went around and I interviewed the managers of all the clinics, outpatient services, and said, of all the people that you see in a year's time, roughly how many would be candidates for home care services? Very soft information, not exact, kind of, but that's the best we could get. So I had each manager talk with their staff, their clinical staff, and figure out how many people they would likely get. And we projected that onto the primary service area of the population that I just mentioned. That's number 1 and 2, and number 3. Grant them the authority to get that information. They have to get it by a certain amount of time, and they would be accountable, maybe in part to me, but maybe more accountable to their manager or to the vice president over those services, maybe also to the nurse managers. So accountability is a little bit nebulous, but they had to get the information. Choosing the right people. Like I just mentioned, they're very knowledgeable and they're available. They have to be available to do this, to do the make the assignments. They're motivated. They're very proud of their jobs, and they're all professionals. So the motivation can come automatically from there. In your situation, it may be more difficult to find somebody who's knowledgeable or motivated enough to do a particular project. Next. Communicate. Describe the tasks and the expected results. Agree on the standards. Identify training needs and resources. Agree on a timetable. And specify what authority is being granted. Going back to my example, I just mentioned what the tasks were and what the results were supposed to be. The standards for people in my department were fairly high, but that was using hard data. The soft information, much more difficult. As far as training needs and resources, for my department, there was no problem. But for their departments, for the clinics, the managers of the clinics would have to identify the training needs and resources that they would need to get that job done. So that was more internal on their parts. Timetable, 1 month, or 3 weeks, whatever it was. Number 6, specified authority. That may come into play more, like if you have $1,000 to spend, you can't do any more than that. Next. Benefits, people are more involved, more empowered, increased productivity and quality. Overall costs are reduced. There's more innovation. We've got the experts working on the material, and greater commitment. If everybody's involved, they feel like they have a role and they're more committed to the final results. Thanks. Follow-up after delegating. Require progress reports. I had many informal reports to give to the vice president and also to other to the nurse managers. My boss, so-so. I mean, my responsibility was not so much directly to him as it was to others. I expect to hear successes and problems. Again, a lot of communication and feedback in both directions. And give recognition along the way. If people are doing a good job, if they're coming along, tell them so. They'll motivate them even more. Referring to the, again, to the Human Resources Management Society, a major factor why delegation is not done well is the failure of organizations to assure managers how to delegate effectively. Better management training certainly would help. And wrapping up, delegating is a powerful statement to employees about how much they're trusted and how competent and valued they are considered to be to the organization. And Toastmaster.
Thank you, Russ. I think we can all take a little bit of piece of that and put it into our lives.